For the future direction, I think that we should have more studies on haploidentical transplant compared to other types of transplant like sibling transplantation and unrelated transplantation. I just mentioned the study by Didi Blaise, but we need more studies that compare the two in a randomized fashion. And as I said, in AML, which is the main indication for transplant today, so the main indication for transplantation overall today is myeloproliferative disease, so being AML, MDS, and myeloproliferative disorder, because in the lymphatic malignancies by the new monoclonal antibodies and the CAR T cells, I mean the role of transplantation is reduced. While in the myeloid malignancies, we are not such advanced from the point of view of new monoclonal by drug conjugated and CAR T cells, because the number of mutation is higher and we don't have great target yet for the immunotherapy or CAR T cells, and we have a lot of off-target effect. But we have revolutionized the field of AML with multiple new drugs. We talk a lot in the last meetings about Venetoclax, hypomethylation agent, anti-CD123 monoclonal antibodies, and the triple combination with IDH1 or 2 mutation to the patient that has it, or FLT3 mutation. And all of these drugs will change the therapy for AML, and therefore will change the scenario for transplantation. So one, we need to give these drugs pre-transplant in order to get the patient to transplant in better shape or with less disease, and to give these drugs post-transplantation in order to prevent relapse or progression. We need to verify the new ICC and WHO definition and categorization of AML in the setting of transplant, so in patients that undergo transplantation. We have no data for these new categories and definition in patients that transplant, and how transplant affects the new categories of AML subcategories that was recently published in June and September this year. And we need to have data on the result of haploidentical transplant and other type of transplant in patients that received this novel agent, triple combination, chemotherapy free, I would say, dare to say, and then transplantation.